Good afternoon, everyone. Thank you all, as always, for being with us today. As you can see on the screen, we have 360 new cases to report today. That's out of 17,219 tests, which is a percent positive of 2.1%. Our weekly percent positive for last week held steady at 2.4%, which is slightly elevated above the 2% range where we had been hovering for several weeks. We are still seeing a lot of cases in Rhode Island, often over 300 or 400 new cases each day. This is partially attributable to the fact that we are doing so much testing. We're continuing to lead the nation in testing, but it also means that we're still seeing a lot of disease in Rhode Island. We are seeing cases throughout the state as well. This is not localized to just one area. 19 out of 39 cities and towns had a significant increase in cases over the last 5 weeks. And in some places, such as Bristol, Middletown, and West Warwick, those increases have been even more pronounced over that amount of time. We're also seeing the demographics of our cases shift to being slightly younger. In terms of hospitalizations, we have 154 people currently hospitalized with COVID-19. As we saw with our cases, we have had a slight increase in hospitalizations generally as well. We know hospitalizations lag behind and are starting to follow the same trend. We're also seeing the slight increases occur specifically amongst people in their 20s and 30s. As I've said during previous weeks, when you think about these data and the trends that we're seeing and wanting to make sure that we bring to your attention, we look across the current COVID-19 landscape to really understand what's going on. We're holding steady, but that's based on two elements that are contributing. We know, as the governor reminded, that there are more contagious variants of COVID-19 continuing to circulate in Rhode Island, and they spread more aggressively than the previous form of coronavirus. Knowing that that's happening, it's actually balancing against the fact that we are doing as strong a job as we are with vaccinations. We have vaccines that are extremely effective against coronavirus that causes COVID-19. And we have done a very good job of getting those people most at risk vaccinated, such as our older adults or those in communities hardest hit that we're focusing on. However, many of our younger adults have not been vaccinated yet, and children are not yet eligible to be vaccinated. And so we need to make sure that those who are eligible to get vaccinated, every single individual, whether they're watching this or not, that they all have access to getting vaccine administered to them. Our takeaway, and we want yours to be, is that the vaccine works. It's really helping us to hold steady during this time as the variant is spreading, instead of increasing in cases to the extent that we are seeing in other states. Everyone should get vaccinated as soon as you are eligible. We're doing everything we can to make vaccine as accessible as possible in Rhode Island, especially in the communities that have been harder hit, such as our higher density communities and our communities of color. We've been working closely with the Governor's Equity Council to make sure that we have slots at the Dunk and our Woonsocket vaccination site this weekend and next weekend for people from harder hit communities. And this is in addition to the age eligibility expansion in several additional zip codes that the governor mentioned and that Tom will go into more detail on shortly. We want to get at this from every angle possible, and we need you to help do your part. People are encouraged to vaccinate and follow that advice when it comes from people that they know, people that they work with, people that they love or are cared for by. As hard as we are working to get people vaccinating and as much progress as we are making, again, we know that the vaccine is just one tool in our toolbox that will get us over the hump. Testing, treatment, and vaccinations. We know that those are the critical elements, and we want to make sure that across the board, everyone is wearing their upgraded mask as effectively as possible as well. It is critical that we continue to wear our masks whenever we are in public, even if you have been vaccinated. And testing is so important because it helps us get ahead of the clusters of cases. We can only identify those clusters and do something about it, get people treated, help them isolate if we know that they're there. And that's why it's important for us to continue to lead the nation in testing. The new guidance that we're announcing for venues of assembly today is anchored on these core principles that we're talking about. We know testing is important, it sets people up for getting treatment. We know vaccinations are important, and we know mask wearing works. The two key dates that we're watching right now are May 15th and June 5th. As the governor shared, it's important for all of us to center around this. By May 15th, we expect that 70% of Rhode Islanders 16 and older will have had at least one dose of vaccine and have had 2 weeks pass since that point so that they can experience the partial vaccination coverage that's important. Getting 70% of our population to that mark of being 2 weeks after their first dose is a milestone for us, and that's that May 15th target. Being able to reach that allows us to have the confidence as we continue to make the changes and expansion in reopening our economy. And by June 5th, we expect that 70% of all Rhode Islanders who could get a dose, out of all Rhode Islanders, children, adults, and all, that it will be 2 weeks after all of those individuals have had at least one dose. The 70% mark and having that partial vaccination 2 weeks out from last receiving that first dose is the same critical marker that the governor has mentioned previously, and it is what we can really center on together. Let's work with everyone around you to get us to that May 15th point so that anyone who is eligible, 16 and older, is able to have at least one vaccine administered to them and receive the protection from that 2 weeks from there. That's our May 15th date. And by June 5th, it's out of all Rhode Islanders. It's 70% of all Rhode Islanders that we're aiming for. With those dates in mind and everyone centered on getting as many people around you that you know to get vaccinated, that's the confidence we can have to move forward in reopening our economy incrementally, safely, and effectively. For events that food will not be served at, such as commencement ceremonies or concerts without food, we're using 3 phases. Between now and May 15th, these events can happen with 250 people indoors or 500 people outdoors. Once we get to that May 15th mark, with everyone reaching 70% of those who are eligible to get vaccinated having at least one dose, our events will then be able to shift to 500 people indoors or 1,000 people outdoors in a way that you can all join in that experience, knowing that the majority of our population has had at least one dose. And then from that May 15th to June 5th timeframe, After June 5th, the events would be able to expand even further to 500 people indoors or 2,000 people outdoors, with the confidence of knowing that 70% of our entire population will have had at least one dose 2 weeks out from that, experiencing the protection. These are markers that we're setting that we can all reach together. You can all do your part. If you haven't been vaccinated and you are eligible, go ahead and get vaccinated. Tell your family members, tell your coworkers, tell your loved ones. The more we can as a state reach those markers on May 15th and then June 5th, the more confidently we can engage in all of the activities that we want to aim for. At all these events, masks are required and social distancing is required. And for any indoor events, testing is strongly recommended 48 hours in advance for all attendees. That's also a place where really pushing to get vaccinated can be helpful, because if you've been vaccinated, that might help replace the notion to be tested to attend those events. With the exceptions of graduations, which DBR, our Department of Business Regulation, is already working with entities on, plans are required in advance for all events with more than 500 people, so that we can work with them and really make sure that the steps are in place to keep people safe. And any requests for outdoor capacity above 500 people must be submitted in advance to DBR 30 days prior to. When it comes to catered events at which food will be served, we are making incremental changes related to capacity starting in May with that May 15th timeframe as well. More information will be posted on Reopening RI tomorrow, and if there are any questions on those changes, Secretary Pryor is here to provide detail. The last thing I want to add on all events, catered and not, is that the way for you to help all of these happen is by getting vaccinated when you are eligible. If we can do it even sooner, with more people getting vaccinated, that's great. If you want to help your child's graduation happen, get vaccinated. Encourage your friends and family members to do the same. If you want to go to that wedding that's on the calendar for this summer, get vaccinated and encourage all those who are attending the wedding to do the same. If you want to help us deliver on the governor's promise for fireworks on the 4th, get vaccinated. It's a way we can really enjoy and do it safely and know that everyone has the protection needed. Vaccines are safe, they're effective, and we're working with our federal partners to have more and more vaccine coming into Rhode Island each week so that you can take advantage of it. And we can all center around these dates and timeframes to continue to advance forward.